So hello everybody, I am Deborah Murta and obviously I'm the founder of the Ketogenic Switch program, and I really wanted to introduce you to Victoria Martin, who is our resident naturopath, and wanted to have the conversation with Victoria around what naturopathy is and how it can help, and why I felt it really important to bring Victoria into our team to offer this as a fantastic service for you all. So welcome, Victoria. I'm just going to tell you a little bit about Victoria. Victoria has been a qualified naturopath and nutritionist for over 10 years. She's originally from England and came out here, I believe, 20 years ago came to Australia 20 years ago on a working holiday and met somebody and fell in love and didn't go home. So as the world travellers do. And since then, you've had two wonderful children and you're running your own practice in Western Australia. And Victoria specialises in women's health and hormones, thyroid and adrenal support, gut health and stress management, which is why I brought Victoria on board for us. And one of the key things that sparked Victoria's interest in naturopathy was struggling with her own anxiety issues over 10 years ago, which sent her on the path of alternative medicine, which is how most people get into that. So, Victoria, I think what I really want to delve into is, first of all, what is naturopathic medicine?
Yeah, well, naturopathy or naturopathic medicine is basically using traditional herbal medicine, nutritional therapy, and traditional healing methods such as detoxification to support and improve people's health. So as a naturopath, I use safe and effective natural treatments, and they work in harmony with your body and allow your body to restore its natural balance. So we're actually utilising the healing power of nature to help your body to heal. So naturopathy or a naturopath, we don't actually do the healing. Naturopathy doesn't do the healing, but it allows your body to heal itself by restoring imbalances and removing the drivers for disease. So this is quite different to often a Western style of medicine or a normal GP style of medicine. We're looking to find the cause behind what you're experiencing. We're not just we're looking at symptoms, but we're not looking to treat just symptoms to make them go away. We're looking to find the cause and treat the whole person and not just treat symptoms in isolation.
Yeah, I think that's so important for people to understand the difference between natural medicine and modern medicine. So modern medicine is very much the treatment of the symptom. You're presenting with a symptom, whereas in alternative medicine, really what we're trying to figure out is the why. And I've just had this theory throughout the 23 years of my career of, if you keep asking why, you'll come up with an answer, and then you get in between that and you go to the next why, you eventually arrive at a root cause, which is generally not only nutritional deficiencies, but there's also the stress factors, the environmental factors. Are we exposed to chemicals in our environment? What are our relationships like? So I think it's not just looking at the physical body, we're looking at all environmental factors, mentally, emotionally, spiritually, and physically, to treat the whole being. And I think what the whole point is that the body will heal itself with homeostasis. You create the right environment. And this is what's so key about natural medicine, and this is what we're finding with the switches in our group, is that by changing their diet, there's a whole cascade of effects that are happening. So, the menopause symptoms, hot flushings are going away, the need for pain medication, especially for those with fibromyalgia and those sorts of conditions, inflammatory arthritis, all those sorts of things are all benefiting from that one thing, because we're actually creating an environment for the body to actually manage itself and heal. So with natural medicine, we're not getting a healing in one part of the body. It's the whole organism that is healed, really, isn't it?
Yeah, and I have to say, I've only been on the team for probably a couple of weeks now, but I've had a lot of contact with switchers in that time, and I've started doing individual consultations with people who need a little bit of additional support. And that's the overwhelming feedback I get from everybody, is how better they feel on the program, how all the symptoms they were experiencing before, when they look back and we go through them all, they're like, yeah, everything has improved since I've been on the program. And that's really fantastic to witness and see in people that when we do, like you say, give the right environment to the body, how it actually wants to heal. It wants to get back to that place of healing. So that's really powerful. I've really noticed that.
Yeah, and I think that speaks volumes of what the ketogenic diet actually does, because it's not only anti-inflammatory, it's the ketone bodies and the effect that it has on the mitochondria and the cells themselves, which is the energy powerhouse for the body. So over time, the benefits just continue to grow. So there's a therapeutic reason. It's not just the foods they're eating, it's actually that biochemical adaptation into ketones. But we'll cover that another time in detail, kind of the science behind it and what's going on. So how can natural medicine help menopausal women that are kind of perimenopausal and postmenopausal?
Sure. So if we're looking at the menopause, obviously it's the end of the reproductive years of a woman's life. So it normally occurs between 45 and 60 years of age. Average age for it to occur is around 50, 51 years. Most people know it's the number of what are called oocytes, certain cells a woman carries, reaches their end point. So there's a decrease in ovarian estrogen and progesterone. So this transition into menopause is called, like you say, perimenopause. Normally lasts 2 to 3 years. And that's when we start seeing the common signs of irregular periods, skin changes, mood changes, depression, memory loss, insomnia, fatigue, all of those great things, night sweats, hot flushes, and these can be mild to moderate to quite debilitating in their effects. So menopause is normally confirmed with a cessation of periods for 12 months with a consistently elevated hormone called FSH levels and a low serum estradiol level found. So there's a lot we can do in natural medicine to help, and this is where natural medicine can really come into its own with something like menopause, because we can look at all of the different common symptoms and things that happen with menopause, and we have a huge amount of things that can help us in terms of herbal medicine and in terms of nutrient therapy. The primary thing which we can do, of course, is nutrition, and that's why TKS excuse me, is so fantastic for this, because I always say primary medicine is food, food is medicine.
Yeah, and I think that's so important because I don't think many people are aware that inflammation is the major driver towards not only menopausal symptoms, but also anything related to age, really. I mean, 80% of chronic diseases have inflammation as an underlying root cause. We'll get into speaking a little bit about one of those root causes soon, which is obviously gut health. But I think this is why, with the program, I'm always saying, let's do one thing at a time. And I think some people make the mistake where they're going to delve into dietary changes, supplements, and try everything at once. Whereas you and I both have the approach that we are more cautious. Let's try one thing at a time so we know what's working. And that way people aren't overwhelmed. So to me, it's get on the program, do a month on that, see how you're feeling. If you're still experiencing menopausal symptoms after 30 days, I think that's where it's time to really assess the treatment strategies that you're currently on. Question if you're on synthetic hormones through HRT, whether there's a better alternative, which of course you and I specialise in the bioidentical hormones and refer people accordingly towards those. So there are alternatives to mainstream medicine as well, which minimises side effects, I think. And I think that's one of the biggest things with alternative medicine is we're really trying to minimise side effects. In fact, you shouldn't have any side effects when you're treating naturally.
That's it. So for example, we look at, the most common symptom probably that people have with menopause and what everyone associates is hot flashes or hot flushes. So about 75% of women that go through menopause will experience that. 50% will have quite severe hot flashes where it's leading to physical discomfort, embarrassment, interfering with sleep. It's adding to stress. It's just downright uncomfortable for people. And is the most common reason that people seek treatment in menopause for hot flushes. Interestingly, the drop in estrogen is a significant catalyst for this, but not actually the only cause. Hot flushes are a heat mechanism initiated by short-term vasodilation near the skin. So the body is bringing the blood up to the surface to try and cool the blood and to lower the core temperature. So menopausal women don't have actually higher core temperatures, but a narrow what's called a thermoneutral zone. So a narrow area that's actually more able to be controlled, temperature controlled. And this can be actually to do with low DHEA levels. So a common one that we have can be as a result of chronic stress, can be complicated by neurotransmitter issues such as GABA or serotonin. Again, we're seeing stress and anxiety patterns here closely linked with hot flashes. So we can actually use a fantastic thing to control and regulate that thermogenic balance in the body is actually magnesium. That's fantastic also for estrogen detoxification.
Yes.
We burn through magnesium so fast that often we end up deficient because we need it to make stress hormones. So it's ironic that we need magnesium so much, but what we need it for, we're burning through it to make those stress hormones. It becomes like this vicious cycle.
Yeah.
And our soils our food are depleted of magnesium, or we're not eating enough magnesium level foods, which is your green leafy veg, your nuts and seeds, which are, you know, awesome that you're getting all of that in the TKS program, but often aren't eating enough. So that's where magnesium supplementation can be great for controlling hot flashes. We can use fantastic herbs, things such as ziziphus. The Chinese herbs are amazing for menopausal symptoms. Ziziphus is not only good for hot flushes, but it's really great for insomnia. So it works on a couple of different levels. Also things such as peony, Rehmannia. Rehmannia is actually something called an adaptogenic.
Yeah, I was just going to say, most of what you're describing there are adaptogenic herbs. Can you explain what they are and why they're good for a whole bunch of things? So the thyroid, obviously, adrenals, and our stress and sex hormones.
Yeah, so adaptogens basically support our stress response, and they cool down immune inflammatory reactions. So when the body is getting too much inflammation, as you just said, Deb, that's a massive driver for most conditions that we see in the body. So adaptogens are actually a special class of herbal medicines. They've been used in traditional Chinese and Ayurvedic medicine, which is from India, for centuries, if not going on thousands of years. And they're used traditionally to promote a sense of well-being. In traditional Chinese and Indian or Ayurvedic medicine, they're considered the kings and queens of herbal medicine. They're known to restore health, they restore vitality, they restore immunity, they support stamina, they promote longevity. So this term adaptogen basically refers to their unique ability to be able to help us to adapt to our environment, adapt to our stress in life, and they do this by normalizing or regulating the adrenal stress response.
Yes.
So there's some amazing things like rhodiola, withania, ginseng, licorice, astragalus, cordyceps mushroom. We have all these amazing things as herbalists that we can actually look at the person, what's going on, what are the symptoms, what's driving it, how long has it been happening for, what's happening in the body systems, and look at these sort of kings and queens of the herbs and think, okay, which one is really going to help this person? And then it can be really transformational.
And I think in a lot of those herbs that you've mentioned also help with another symptom of menopause, which we don't discuss enough, and that's low libido and lack of sex drive, and what's actually happening with our sex hormones. And, you know, I think this is this stage of life, we're moving into a new life phase. Many women that age have children have left home, and to me, often in marriages and relationships, it's an important time to kind of recreate the early years of your marriage and intimacy. And I know that a lot of women are affected by that as well.
Definitely. And that's where I love the Mind Switch part of the program too, because it really is about actually quite often when we get to this stage of women of sort of 40s, late 40s, early 50s onwards, the children may have grown up a little bit, becomes much more about ourselves. And we've actually forgotten what we want. We've forgotten who we are. We've forgotten what makes us happy, because as women, we've been the carers and often working at the same time. There simply hasn't been time. And bringing that all together into the Mind Switch to kind of, like you say, really take this time as a refocus on yourself as a priority, as an importance, as a key entity, and as actually looking at it as a positive time. It's really portrayed, you know, in the media and all around us as, oh, menopause, that's this and that and negative. No, it's like, actually, no, this is like you say, it's another start. It's a new phase. And
it's a new life phase. We're transitioning into a new life phase, and it's an opportunity to kind of reinvent ourselves, I think, as well. Yeah, absolutely. So with adrenal fatigue, you and I were just chatting before about adrenal fatigue, and there seems to be quite a bit of myth around that, and a lot of women are currently being misdiagnosed as having adrenal fatigue, and I think that what I'm seeing often is because they're on a carb-heavy diet, they're not controlling their insulin levels, their body's inflamed. That naturally creates tiredness in the body, especially if women are on an unhealthy diet, a diet full of grains and sugars and chemicals. The body, what people don't realize is about 80% of our energy in the day is actually spent dealing with digestion.
Yeah.
So when we're not on a natural whole foods diet and we're putting a whole lot of crap in our bodies, what is actually going on is the body is burning through energy to try and make sense of what's actually coming into the digestive system itself.
Yeah.
So I think, do you want to comment on that? With the adrenal fatigue, I think sometimes it's just a case of balancing that actually sorts the whole energy system out. And what I know and what's coming through in the data now is that a lot of women are being misdiagnosed as having adrenal fatigue because they may have done a salivary test or a blood test to show low cortisol levels. However, when we look at the whole picture biochemically of what's going on, they actually have high cortisone. So it's actually a buildup of the wrong kind of cortisol in their body creating these issues. And something else you mentioned earlier about estrogen metabolism and magnesium being important for that. I think that's also something we should quickly touch on, is really how our body metabolizes hormones is absolutely fundamental, especially in terms of preventing hormonal cancers such as breast cancer. Do you want to comment on those two things?
Yeah, definitely. I mean, to just touch on adrenal fatigue first, adrenals are tiny little glands on top of the kidneys, and they control our stress response, our immunity, our blood pressure. There's lots and lots of functions they control. So adrenal fatigue, I agree, is present, but it is often overdiagnosed. And the problem is if you go purely on symptoms, if you were to look at a list on Google, you could basically think, oh, that's me. I've got
most women would fall into that category before they join the program. Yeah,
definitely.
Yeah.
So they're sort of saying, they are overweight, especially around the middle. They've got problems with sleep. They've got poor immunity. There's chronic exhaustion. There's sugar cravings. There's caffeine. There's cravings. There's problems with blood sugar, poor mental function. A huge lot of that, if those symptoms, if you go into TPS and actually clean the diet up, actually put in what you need, put in the fiber through your good veggies, put in your good fats, put in the right amount of protein that you need, the essential fatty acids, those key elements, then you will actually, a lot of those symptoms will get better. You can't necessarily say that if you have those symptoms, it's adrenal exhaustion. If you have been under a period of chronic stress and you're not dealing with stress properly, that can throw out how your body is dealing with hormones. There are hormone releasing centers of the body, which I know you've touched on in other broadcasts, Deb. We call this the HPA axis, which is the adrenal glands, the hypothalamus and the pituitary. Hypothalamus, pituitary, both in the brain, the adrenal glands on the kidneys. They are the hormone releasing centers of the body. They can be affected by chronic emotional, physical, mental stress. But how we actually deal with those hormones, how we're releasing hormones, is very individual. And that's why both you and I do like to do some functional medicine testing sometimes to check where people's cortisol levels are. What can happen during menopause is that there's a transition of the ovaries and their functions. So the ovaries tend to slow down. So the adrenal glands tend to serve as their backup. And the adrenal glands also serve as the thyroid gland backup, not wanting to stray into thyroid conditions. But adrenal symptoms, menopausal symptoms and thyroid symptoms are all very closely mirror each other. and they're
Yeah.
very closely linked. And that's why it is great to talk to a practitioner where we can actually nut out where are things coming from, where is your priority, what are your primary causes, what's been going on through your life, how stressful have things been, where are your hormones. We can test some hormones and actually see where they are, instead of sort of treating on a bit of a guess.
Yeah. And I think this is where the dry urinary tests come in. I mean, there's wonderful new tests available now that are actually looking at the metabolites. So how are we excreting hormones? And so one really easy example of this, so that people understand where I'm coming from, is that estrogen, for instance, should metabolize through a pathway of A to B, right? So we're producing it, we're excreting it, and that's a healthy metabolism. So that's, it's being excreted at the other end, but then reproduced. But when things go wrong in the system, instead of going from A to B, it goes from A to C, and it can build up in tissues in the body, creating issues. And this is, related to certainly breast cancer in particular, and hormonal cancers. So these wonderful tests now that we have available actually show us where your hormones are. And there's comprehensive versions. We can snapshot that test, or we can look at it over a month to actually look at the entire cycle, especially for perimenopausal women. I think it's really important. And then we can actually piece together exactly how they're metabolizing those hormones. And that gives us specific, targeted ways of treating things without the guesswork.
Absolutely. And just to go back to the estrogen lying down in cells, as you were mentioning, that is something I'm sure you've seen a lot in clinical practice with perimenopausal women, is when you test hormones, how many women have what's called estrogen dominance?
Yes. That's so important. Can you just cover estrogen dominance quickly and tell us what it is? Because it's definitely something that I've dealt with for 23 years clinically, and so to put it really simply, it's basically when our estrogen levels become too high in the body, and they, in effect, then actually become almost a driver. They become a cause and a driver of estrogen-dependent cancers. Cancers will actually feed on, and they will promote cancers which are caused by estrogen in the body. So we have to be careful with, we can actually, again, this is where when we test these hormones, we can actually use herbal medicine to bring these levels down. We can actually use specific supplements to bring these levels down back to safe levels, and actually cut people's risk of developing hormone-related cancer. Estrogen dominance, interestingly, the symptoms, again, this is where things why it can be so valuable to test, is the symptoms can be the same as normal PMS. It can be that you're a bit cranky, that you're just a bit irritated with life, a bit annoyed. It's actually quite a strong, if you know that kind of PMS kind of frustration. Yeah, it's the explosive anger, and I liken it to people living that week or those few days in their pain body. You've got no ability to stay present within that time, and it certainly trips a lot of women up. And just to explain quickly what the estrogen dominance is, you can go off to the doctor and be tested for your estrogen progesterone, and they may come back within a normal reference range. So the doctor will say there's nothing wrong with you, your hormones are fine. But what we see is that the progesterone's on the low side of mean, so the low side of where it should be, and the estrogen can be on the high side, and that within itself creates the dominance effect. So what we're talking about here is kind of the balance between the two. And low progesterone is something that is so prevalent in so many women, and if you've got low libido, that's the first place I'd be looking at, because I remember after having my third daughter, I was 33 at the time, and I went on to some natural progesterone for about 6 months. It was all I needed to top things up and get back into balance. But I had hormones like I was a teenager again. It really made a massive difference in actually restoring a libido that had been gone for a very long time. And progesterone is also very anti-aging. So I think also, while there's bioidentical hormones available and they're very good tools, you need to be really closely monitored. Just because it's natural doesn't mean that it's not going to create an issue long term. So hormone replacement therapy really needs to be judged very, very well and monitored carefully, because what can happen is if we start having too much, if I was to stay on that progesterone for the last 15 years, for instance, my body would actually stop producing its own balance of progesterone. So sometimes we've got to entice to bring things back into balance, but not overdo things where we're actually creating a long-term disharmony as well.
Yeah, exactly.
That's why you need very good naturopaths and good ongoing testing to monitor those things.
Yeah.
I think what you alluded to before, Victoria, is just something that I really want to drive home to all of our switchers. And that is that natural medicine is not just about, we're not the ambulance at the bottom of the hill. That's A&E. And that's the doctor. We are really about longevity medicine, where our focus is on what can you do today to prevent something from manifesting down the line. What can you do and how you manage your health on a daily basis in terms of diet, exercise, sleep, all those things, making sure you're checking in with your hormones. As soon as you're 40, you need to get some functional tests done every few years to just keep on track, I think, to preempt what could be around the corner and bringing things back into balance. That's really about being your own advocate and staying in control of what your path is. Because I liken it like this, right? People are at a crossroads and we either hand our power over to what will become. So we stay on a crappy diet, we just go to the doctor, we take the pill, we take those pills for a certain amount of time, then they create side effects, we end up on more pills, and we really go down a road of premature aging. Whereas we're in an age now where we have so many amazing tools at our fingertips where we could add another 15, 20 years to our life if we really, and the quality of life. And this is what I don't think people understand. What we're really coming from is the quality of life to the end of your life. So we know that by the time women reach 50, on average, people have something like 5 diagnosed medical issues.
Yeah.
It's ridiculous. But if you stay on a healthy path, right, your quality of life in those last 20 years is going to stay right up there. We all know wonderful old people that just were walking around, doing yoga, doing everything right up until the very, very end. And I think that's what we should all be aspiring to do, so that we're not just reaching our 60s and laying down and just accepting age. This is about the quality of life and what that means for us long term in our families and our relationships and things like that. So that's, I think that's it's staying ahead of the game and being really in control of kind of what your destiny is, I suppose, in terms of health and well-being.
Absolutely, because after all, prevention is the best cure. If you can look at things early, actually, like you say, get things tested. Even if you're actually feeling fine, what is going on with you? We can't see inflammation a lot of the time. We can't see changes in hormones. So what is happening with you? And like you say, taking control, it's a really powerful thing. And we have so many of these things at our fingertips. And so
I think, Victoria, one of the things that, because I want to kind of, one of the things I'd really like to convey here is that doctors have very limited ability and scope within their testing. And one thing that we do, and there are certainly doctors out there that practice what's called integrative and functional medicine. And that basically means that they're using the best evidence-based medicine on both sides. So there are alternative medicine, what you and I are prescribing in terms of metagenics primarily, and we're really focused on things that have been very thoroughly clinically trialed and tested. So we are using evidence-based medicine, and a good GP will use both sides of that. They'll use drugs where necessary, and you and I are not anti-drug at all. We believe that there's a place for everything. So I think that's really important, that we don't come across as being one way, because we're not about that. It's about using what is evidence-based medicine. So I think, Victoria, the bottom line and why I brought you in on staff with us here is because we can only do so much within the diet. We can only do so much within the Facebook group. And there are so many people in the actual group that would really benefit from having private consultations with you to really get that snapshot of where they are. I think we both are in agreement to get on the program for 30 days first. Yes. And see what symptoms are left over, and then certainly go in and be in control of your health and see what we can do to help with those ongoing symptoms.
Absolutely. Yeah. And I just want to finish by saying thanks so much, everybody, you and everybody that I've met on the Facebook group, that has contacted me by email, that I'm in conversation with, that I've talked to. Everybody's just been so lovely and welcoming, and it's so wonderful to join a group of like-minded women who really are on a journey, and such a positive transformational journey. It's really special to witness what I see on a daily basis. So yeah, I just want to mention that too, because it's
I totally agree. I mean, it would be impossible for me to ever have a down day, because I go into my group page and I read these amazing transformations on almost an hourly basis. It's overwhelming. I have tears in my eyes most days. And I was talking to my middle daughter last night, and I said, what we've created here is so unique and special. In a technological age where everyone's feeling more disconnected and more busier than ever, what we've managed to do within this group is bring back community, a sense of absolute love and connection, which is one of our primary human needs, and create this incredible community. And many of these women are meeting in groups and pods all around Australasia at the moment, which is just amazing. Like, it's become a whole movement. But, you know, I think a lot of us will never get to meet, but we have this connection through this group, and it is just the biggest thrill of my life, this program. Absolutely. So Victoria, I want to thank you, and we'll catch up again next week, and I'd like to chat with you next time about thyroid health. And we'll cover that one next time as well, because that's a big one. And of course, if we work on all these pieces of the puzzle, it'll all come together.
Absolutely. Great.
Okay, thanks Victoria.